I'm Dr. Jim Coyle, and this is the next tutorial in social work practice with individuals. I'm going to be talking about solution-focused therapy. And when I was in practice, I used this model extensively because I thought it was positive, it worked with the client, it was efficient, and for the most part, effective. And so I want to talk to you about my experiences that led to those decisions. Okay, solution-focused therapy is based on postmodern theory. So we've already moving into quite a different way of viewing the world. Postmodern theory denies that there's an absolute or objective reality and instead focuses on life being changeable, random, and defined by the meaning attributed to the event. In some ways, it's similar to the cognitive theory that says the way we think influences how we interpret things. And postmodern kind of philosophy, it goes a little bit further than that because it's not only a person's internal thinking process that helps interpret what's going on, but it can be culture. It can be the what is happening around them, current events, as well as the social events. These days, the pandemic is influencing quite a lot of people in terms of how they are seeing problems and how they're seeing the stresses that they're dealing with. This always made a lot of sense to me because when I worked with clients, I could see that often it was their interpretation of the meaning of what was going on in the presenting problems that they were coming to me about, and that was the key, and that the meaning could be very, very different depending upon what they were attributing going on. So in solution-focused therapy, it's to move the focus from the problem to the solution, from the past to the future. We're going to talk more about that. But first, ask yourself, what do you know about postmodern theory, about solution-focused therapy? What do you know from your past learning, from your past experiences, from your observations of people and work with clients, as well as from your current reading? What makes sense to you? Or what do you see that you're uncertain about, or questions do you have it? Jot down some ideas about that right now, because we're going to talk about this in class. Okay, solution-focused therapy concepts, as I mentioned, they shift the focus, where previous models that we've talked about have been really about what influences the problem and how to counteract those influences. Solution focus is much more interested in what happens when the problem is not occurring and considers how can you make that happen more often. So it's not so much trying to figure out where the problem comes from or what factors are going to influence that. It's when the problem isn't there, having the client really identify what's going on there and then having them do that. The primary concepts that underlie this is change is constant and it may occur rapidly, that it's not as difficult for change to happen as some of the other models would conceptualize. It also says, and this is what I think one of the real positives of it, is that clients have the strength to resolve their problems and you need to trust them. Instead of assuming that a person comes in because they don't know what to do and they don't have the skills needed, it is based upon the fact that clients do have some ideas about this. And not only did I see this happen in my practice, but the research that I was doing on resilience, particularly with families, showed this, that when you focus on what people are able to already do well, that's a much better beginning and helps people feel much more hopeful and confident in themselves than in trying to focus treatment immediately on, I have to teach you how to do something that you don't do very well or that you don't know about. So it's focusing on the strengths, on what clients are able to do. So it focuses on exceptions to the problem as well when things are going a little bit better. It de-emphasizes problem talk and emphasizes solution talk. An example of this is when you ask a client, what will be going on if the solution occurs? Just changing one word can make that much more powerful what will be going on when the solution occurs. So it automatically supposes in terms of your own language that something is going to happen that's positive, and that you talk that way. And you talk, okay, how are you going to know when this happens, not if this happens? And so just using that, kind of paying attention to your language can be very important here. So it's de-emphasizing problem talk, emphasizing solution talk. It's helping clients identify and implement the solutions that make sense for them. Now, similar to what I said when I talked about cognitive theory, is that it's important that you work with the client to discover the solutions themselves, rather than for you to suggest, well, this is a solution that could work for you. Because so much of it has to do with, it has to make sense for the client. And you want to take them through. So using Socratic questioning here can be really helpful. And so there are some similarities in terms of this. The broadness is that it doesn't necessarily have to focus just on how a person thinks or believes. It can be lots of other things that are going on in their life that may be part of making a change. Solution-focused methods were developed by Steve DeShazer and Insoo Kim Berg. I first learned about this I learned about brief therapy, which suggests that, and this was from the people from the Mental Research Institute in Palo Alto, California. And they said something that was very important to me, and that is that, change doesn't have to take a long time, that it can happen quite quickly, and that you need to allow that to happen instead of just assuming that people need long-term, lots of counseling sessions in order to have something happen. In terms of specifically solution-focused methods, I learned primarily from going to conferences by Bill O'Hanlon, who talked about possibility theory, and has a lot of very specific solution-focused methods, such as changing the doing or changing the thinking, and really identifying what is going to be different ways that you can look at the future. DeShazer and Berg talked about how assessment and intervention occur together, and that it's really about a different process. And when you ask about when the problem doesn't occur, the exceptions, or what the person's previously done, the pre-session change, or the hope for the future, when that outcome is positive, what you're doing is you're focusing on assessing, how do I best help the client identify what the future is going to be, instead of assessing, how do we figure out what is causing the problem? So there's kind of a middle piece that's left out here. And, in previous models, you sort of have to figure out, where's the problem come from and what do we do about that? In this, it's not so much important to talk about where the problem came from. It's talking about, how do we put into operation the solution? One of the ways to do this also is DeShazer talks about assessing the difference between customers, complainers, and visitors. Customers are the client that you want to have. They're coming in, they're saying, I have this issue, I'm going to do, I want something to have happen, and you work with them around this. Complainers are those that say, okay, well, this problem is there, but I don't see how I can do anything about it. And sometimes they look to the worker to take care of the problem for them. Since so much of this model depends upon them identifying the exceptions, there's generally, that's not going to work within this model, the complainers. And generally speaking, what you do is you give them a kind of a first session task to do, and that is between now and the next time that you come in, pay attention to what's going on that you want to have happen again, that you think would be good, and let's come and talk about that. So it's moving them away from being helpless to do anything to noticing when things happen. Now, that they may think that those things happen not because of themselves, but because of other things, but that at least gives you something to focus on, is how can they make those things happen more. Now, the visitors are often a way of talking about people that come in and they talk about a situation, but they're not sure that it's bad enough to do anything about, or they're not sure that they can do or are willing to do this about it. And so the issue is they're not really engaged. And so you may talk with them about the fact that, well, maybe you need to take a look at this and see whether that's worth something, putting some effort into it. And you can give them a similar first task to what I just described for the complainer, but you may also want to say is maybe it's not the right time, and maybe you ought to just kind of do what you're doing and see what happens. And that's kind of a strategic technique that strategic therapy does influence solution-focused methods, but it's suggesting that the person is in charge of their own life without coming directly and confronting them about it. When you use solution-focused therapy to help clients, you assess the client's ability to identify and then implement solutions. So it's not so much about the problem, it's about how can they identify the solutions. And the techniques that go along with that are presupposing positive changes. So always talking about, okay, when the solution occurs, when things are turning out better, when there are things in your life even now when things are better. It's always supposing that there's a better thing that they can begin to identify. And if they have difficulty with it, then you say, well, how about something that's a little bit better? How about something that is closer to what you would like to have happen? What else, that's when you can go to the miracle question, which I'll be going to in a moment, and talk about, kind of, hypothetical. But before the miracle question, the exception finding is, kind of looking at those alternatives. What's going on when things are working a bit better? The miracle question can be very powerful, but it kind of needs a little bit of setup for most people. That's why when you hear Insoo Kim Berg or Steve DeShazer talk about it, they usually start off by saying, well, I want to ask you something that's kind of silly or kind of out there or kind of fantastic. Are you willing to at least listen to it? That again is a strategic method because you're already cueing somebody in to something that this doesn't have to be realistic. Just are you going to at least listen to it because I asked you to? And most of the time people say yes. If they're not interested in it or they don't respond to it, then maybe this is not the model to use. Yes, there's ways that you can use within this model to kind of help the person begin to appreciate it. But sometimes when I was in practice with clients that just didn't want to go in this direction, I found it more efficient to try and do something else that did fit for them. So what's the miracle question? Okay, so let me suggest something that's kind of unusual, but if a miracle occurred while you were asleep tonight, and you don't know about it because you were asleep, when you woke up in the morning, what would you see? What would you hear? What would be going on that would tell you, gee, a miracle must have occurred? And then you get them to focus on observable behavior, on things that were going on that you can actually, can talk. Not that I will not feel depressed anymore. Okay, well, what will tell you that you're not feeling depressed? In the video example, they talk about, somebody who's somebody's alive again. And that can be really difficult. But instead of talking about, well, that's not going to happen. Well, what would be going on if that person was alive? What would be happening then? What would be happening? Maybe it wasn't so much alive as if her parents were actually back together. That was what it was. And that's in the video that's coming up. That may not happen, but the client was able to talk about what are the things that can go on as a result of that. And so the thing is you get them talking about futures in which the problem doesn't occur. And then scaling questions are about, okay, on a scale of 1 to 10, how sure are you that you can do this? Or how much effect is this going to have? And when they rate it, you ask them, okay, how can you move that 1 point? So that it's not a matter of kind of getting them, their expectations are have to go from 3 to 10. How do you go from 3 to 4 in terms of your rating schedule? First formula task is what I mentioned before. Pay attention. When things are happening that you'd like to have continue to happen, pay attention to that. What's going on? And let's talk about that. So here's that role play. Danielle's reacting to her parents' divorce, and I want you to pay attention. How did the therapist help the client identify hope, look at solutions, look at exceptions? How about using the miracle question, using scaling questions, identifying the strengths that the client had for change, as well as how did this fit into and maybe change around a little bit, engagement, gathering information, assessment, plan, goals, and intervention. So the thing is that you're taking a look at that's a process, and that solution-focused therapy uses it a little bit differently, but they're all still there. You can review the handout that I have on Blackboard about solution-focused therapy flowchart, and that'll give you some ideas for the role play about how you can actually identify exceptions and pre-session change and use the miracle question. There's also an interesting example using solution-focused therapy with in the textbook. It's called The Journalist, and it's about Felicia. I suggest you take a look at that. It's a very interesting case example. So what are the benefits of solution-focused therapy? Well, it focuses on strengths and positives. It tends to strengthen the worker-client relationship, and I think that's real important. Initial change may be small, but it tends to happen quickly. You see, if you can get people to change even just a little bit, it gives them a template and some confidence that further change is possible. And that can make that inertia can make a really big difference. It identifies and uses the client's inherent change process, which I think is really powerful. Now, there have been some critiques about solution-focused therapy. It says it ignores past experiences and beliefs or feelings and how they influence the presenting problem. And from proponents of those particular models, yeah, solution-focused therapy misses the point. Proponents of solution-focused therapy would actually counter by saying, well, that actually isn't important. Some clients may lack the skills or knowledge, and so the worker may need to educate them about that. I'm not sure that that's going to be any different than educating them about cognitive distortions or, kind of internal mechanisms, some psychodynamic approaches. There's a certain amount of education that goes on there also. People who are really into a problem focus say that the intervention may be superficial and that exceptions and miracle questions don't really address the problem. Again, from this perspective, there's a disagreement about that. Deep set problems influenced by multiple factors may not be able to be resolved by just doing a positive behavior, but you can certainly help people feel more confident, maybe take a little bit of the tension off. And then if they kind of slide back and some of this other stuff that comes from more deep set problems or trauma from childhood or other issues come in and that seem to come up again, then maybe you can consider whether there's other treatment methods that would be helpful. As I've mentioned in every one of the tutorials, it helps to kind of take a look at this point. What did you learn? What did you read about? What did you learn in the tutorial? But how does this also relate to the experiences that you've had with your clients? Jot down your notes about this, and that will be something that we can talk about in class. And so once again, I'm looking forward to our discussion in class.